Today we are delighted to say that we have access to a virtual simulator to train our young cardiologists in complex electrophysiologic procedures. I'll make it a little simple. These are important technical procedures to cure rhythm disorders of the heart. Patients with rapid heart rhythms called atrial fibrillation, patients with heart failure who require a procedure called as cardiac resynchronization therapy can all be now taught to young doctors even before they go to a patient. We train them in a virtual environment with this virtual simulator. After they get enough skills here, we take them along and help them to learn the skills over a period of time. They are trained cardiologists from different parts of the country who train with us for 1 to 2 years in these complex procedures. And that is where I find it very useful. The training session would be anywhere from 2 to 3 days. Ablation, atrial flutter ablation. Then there are called as LA linear lesion creations, transeptal punctures, and coronary sinus cannulation and LV lead placement. These procedures used to be done on a patient with the help of the senior and a junior physician working together. Now we find that this virtual simulator helps to shorten their learning curve, and instead of training on 10-15 patients, just training on 2 patients may be enough now because their learning process is shortened by this technology. It is not the ultimate technology because whatever it is, nothing can equate practicing on the patient's real practice. These are only to aid and shorten the learning period, but they cannot substitute the real learning at the patient's bedside. So assessment of a patient, assessment of whether it is required or not, safety of the procedure, efficacy, all these things comes with clinical judgment, and that is an important process of training more than just the technology alone. There is an increasing role of technology in day-to-day hospital practice. It has its advantages and disadvantages. Let me just tell you about the advantages, because I have seen medicine over the last 3 decades. We had been practicing in the absence of technology, and we didn't have the luxury of diagnosing the complex disorders and treating the complex disorders, which have become treatable in the last 3 decades. So that's a clear benefit from patient point of view. The disadvantage is increasing invasion of technology has made it a little impersonal. Medicine is becoming impersonal. We are a little worried, seriously worried about this. So there should be a human element in taking care of patients. That is vital. So it's extremely important that we should not lose that human touch while caring for patients. About 3 decades ago, the commonest cause of serious illness and death in India used to be due to infectious diseases like tuberculosis and so on and so forth, say in 1950s and 60s. In the next 30 years, the commonest cause of death and morbidity is going to be due to cardiovascular disease, either heart attacks or due to heart failure where the pumping becomes weak, or the heart rhythm becomes abnormal where it twitches very rapidly or slowly. These things are going to be the major cause of morbidity and mortality in the coming years. The biggest challenge is for a medical professional is the cost of medical care is escalating. We find that there are lots and lots of patients who are suffering from these serious disorders, but unfortunately the technology and the tools that are available are quite expensive for most of the patients. So it is very, very important to make this affordable to the common man. And I think one of the important steps is the below poverty line scheme, which is operating in the state, which has made it affordable for a lot of common people, and that has really opened the doors for a lot of these people. But having said that, I think there has to be a lot more emphasis both from media as well as from professionals to prevent diseases. More than treating diseases, we should go out of the way to prevent these diseases. that is the most cost effective way of treating patients in Indian scenario.